Sheila, are we good to go? Okay. All right, we'll call the meeting to order. We'll begin with roll call.
Mr. Young?
Here.
Mr. Furman?
Present.
Mr. Cowan?
Present.
I'm sorry. Mr. Torres, he notified me he will be around 5 o'clock. Dr. Hans? Here. Ms. Newman? Here. Ms. Root? She did send notification she'll be 50 minutes late if she attends the meeting. Ms. May? Here. Ms. Woodruff?
Here.
Dr. Giles? Pastor Jones?
Here.
Mr. Landsman? Here. You have quorum.
Thank you. The next item I have is the approval of the agenda. We do have two modifications. One is we will, the Cumulus contract has been withdrawn for this meeting. That's under Finance Committee B4, so that would be withdrawn and not on the agenda. And also we've had a request after public comment to have a closed session for a pending claim and negotiations regarding the claim. So with those two amendments,
Move for approval.
motion. Supported. Any discussion? We don't need, Sheila's just a voice vote. All those in favor say aye.
Aye.
All those opposed? We have an agenda. Before we get to our first regular order of business, it's my privilege to welcome our newest board member, Pastor Douglas Jones, who indicates that he spends most of his days at his church in Pontiac. And Pastor, welcome aboard.
Thank you very much. Glad to be here.
Okay, we're glad to have you.
Thank you. Excited about working with such a distinguished group.
Wow. Well, maybe you should wait until after the meeting. No, thank you very much. So our first order of business under the Finance Committee is financial review. Patrick Franklin, come forward, our interim CFO.
Mr. Cowan,
Yeah.
We have the first round of public comment.
I apologize.
Mm-hmm.
Public comment. I was so excited to be considered distinguished that I missed public comment. Do we have anyone online or?
We do have several anonymous public comment in the online form, and Bernard has come forward to explain the procedure related to anonymous public comment.
So in the ordinary course, most of our comments are received with a name and an individual's contact information. So we tend to receive them at the board meeting and then respond to them subsequently. However, for this circumstance, because we have received anonymous public comment, we have actually, we will read those comments to you and we will actually respond at this time as well, because the person, whomever they may be, who did offer the public comment would only be able to receive a response by attending virtually the meeting. Okay, so for that reason, we are going to present those public comments and responses at this time.
Okay.
Is there anyone that's going to be, are you reading all the anonymous public comments, or is there anyone that actually wants to make a public comment in person or otherwise?
So anyone who is here currently who has a public comment and they would like to come up, please do so, and then at the end we will read the anonymous public comments and their answers.
Okay. And for those who may want to speak, each person is allotted 5 minutes to speak. Is there anyone who wishes to? Nobody's on the phone. Okay. Do we have anyone in the audience that wishes to speak?
Before Linda responds, I'm going to just note there are a few comments in the online form. Just note some of those that the ones that Linda will address are a bit more lengthy. There is one that was submitted on 5/5, and it was indicated Sheila-Test. And the next one was also on 5.5, and it was a question, where is the comment section? And then also indicated an email that is, why is there no comment section at y.com? Additionally, on 5.5, there was another testing again and checking at gmail.com. And then the next one that Linda will read is also on 5.5.
Okay.
Good
All right.
evening, everyone. The first anonymous,
Linda, do you want to give your name and title? Just
I'm
so
Linda Bartoloni-Till. I'm the manager of customer services
Okay,
here.
thank you very much.
The first anonymous comment I am going to read came in on 5/5/23, and the following was written. I would like to put forward the following questions at the May 8th, 2023 Committee of the Whole. Number one question, can the CEO guarantee that the CEO evaluation survey responses are anonymous and will not be tampered with or deleted? Answer. The answers are from OCHN. The survey is anonymous and not tampered with, nor are answers omitted. Question number two, will the survey comment section responses be provided to the board, or will the board only be provided with survey scoring? Answer. All comments submitted will be provided to the OCHN board. Question number three. Why is the survey facilitated through OCHN's HR department instead of an impractical third party? OCHN uses SurveyMonkey, a third-party tool to facilitate the data collection for the evaluation. However, other resources can be considered at the board's discretion. Question number four. Why is there no mechanism for staff to speak to board members directly without risk of reprisal? Answer. The OCHN Corporate Compliance Officer is a reporting mechanism and provides information to the Board of Directors. Any questions or comments can be confidentially shared with the Corporate Compliance Officer. Question number five. Is the employee turnover used to evaluate the CEO's performance? If not, why? The performance evaluation metrics is included in the CEO's employment contract. Question number six. Why does the CEO not answer the board's questions regarding staff and staff departures? Answer. Under the advice of Corporate Compliance and Human Resources, the CEO provides responses to protect the privacy of the individuals involved. Question number seven. Why is the hybrid work policy not enforced towards the chiefs, but is expected to be followed by the rest of the staff? Answer. The hybrid policy applies to all staff. Question number eight. Why was the online form for public comment changed from previous years? Answer. Previous to the pandemic, all OCHN board meetings were in person only. The various online options were added during the public health emergency and to align with the hybrid meeting policy. Question number 9. When I first assessed the form, there was no field or option to provide my public comment. Why did this form not have this field? Answer. The form has been recently compromised as reported to the board by the OCHN board liaison. OCHN is looking for a transition from Microsoft Forms to Smartsheets to rectify this issue. The issue is being investigated. Question number 10. This field was re-added to the form after I reached out to OCHN through the support email address provided on this website. How long was the field missing from the form, preventing myself and others from submitting their public comment online? Please know, I never received a response from OCHN. Answer. Customer services did not receive a message about this situation. However, a comment was recorded in the public comment form. There appears to have been an anomaly, but there was immediate resolution within 24 hours with no impact of the integrity of public comment. This issue is being investigated. Question 11. What is the chain of custody for the time a comment is submitted to the time it reaches the board? All public comment submissions provided via the phone online forms or in the meeting chats are read up until the last public comment period at all the OCHN board meetings.
If I may, just a point of clarification, that public comment was submitted on 5/7.
Okay. Okay, so this one was the next one I'm going to read is from 5/5.
5/8.
5/8. Okay, 5/8. The following was written. This is the second one. I am an OCH employee with strong concerns about our current executive leadership's conduct, direction, and decision-making, as well as the climate that has been fostered in the past few years and the effect it has on the organization as a whole. I know many others who share my concerns but are afraid of retaliation if they speak out. I share this fear, which is why I'm choosing to remain anonymous. I want to know what are our options to safely express our concerns to the board. The CEO and CLO refused to answer many of your questions regarding OCHN staff, and anonymous public comments during these board meetings should not be our only option. We were told that the CEO survey is our opportunity to give feedback, but the survey is facilitated by OCHN. This is a direct conflict of interest, and given the lack of trust, gives no reassurance that our responses are actually anonymous or that they will be shared with the board. I believe that if staff were provided a safe outlet that directly reaches the board would see an increase in feedback that would more accurately capture the state of the organization. The health of our organization impacts not only its employees, but our ability to serve the community. Thank you for your time. Response. The board's primary role is to provide fiscal guidance to support OCHN's service delivery system. The board only employs its OCHN's CEO. All other OCHN employees' concerns should be submitted to OCHN Human Resources and/or the Corporate Compliance Officer. Both are responsible for ensuring their staff rights and privacy are protected. In regards to the CEO feedback survey, OCHN uses Monkey Survey. This is a third-party tool to facilitate the data collection for the evaluation, and it is anonymous. OCHN HR team assists in the survey at the board's request. SurveyMonkey does not provide email responses information, only answers to the question. Okay, and I have one last one that just came in a little while ago for 5/8, and the question is, do the Chief Legal Office and the Chief Corporate Compliance Officer report to the CEO or the who are they? I can't read that word. Do the Chief Legal Officer and Chief Corporation Compliance Officer represent the CEO or OCHN? The answer to the question is they represent OCHN. And that concludes the anonymous public comments.
Okay. That was all 12? All 12 of them? That's how many I counted.
I think there's 12.
Okay. All right. Well, thank you very much, and thank you for putting together the responses, you and whoever else put those together. All right. So there's no one here for public comment, and there's no one else online, and we haven't received any other comments. Okay. Thank you. Then I'll close public comment. Now, we can move on to the financial review with Mr. Franklin. Welcome.
This is our financial review for the day ending March 31st, 2013. This first graph is the MDHHS payments from October 2022 through March 31st, 2023. As you can see, this is our monthly dollars report. The red represents the DABS, which is disabled, aged, and blind population, which is our biggest revenue. TANF represents temporary assistance to needy families, and then Healthy Michigan. Those are the top three. And then when I look at it, this is the MDHHS payment. They're consistent with the funding from month to month. Most of the revenue is pretty consistent, especially the Medicaid portion. The line chart that goes across the graph shows the fiscal year 22 data, and each month is represented by the bar chart for fiscal year 23 by month. Next chart is the data based on DABS, TANF, and Healthy Michigan on the number of eligibles. Sorry, it looked like we missed the... And the line chart for 22 exactly is the same across for the representing 22 data, and the bar chart represents the number of eligibles per month. One thing I want to note is that the number of eligibles is slightly higher in 23 compared to 22. The next slide talks about data for 6 months, October 1st, 2022 through March 31st. Receivables decreased from September to March, but it's not totally reflective in our cash totals. But if we look at the next slide, you'll see the payable debt went down. All other categories were pretty much consistent from September to March, other assets and capital assets. Other assets include things such as grants, rental revenue, PA2 revenue, investment income. Those things make up other revenue. The next slide talks about net position comparison. The chart shows all of our assets minus our liabilities at this time. It shows our net position has decreased. If I look at this graph, it shows that our assets minus our liabilities equal our net position, which is, in this case, for the month of the 6 months of this fiscal year, $6 million or $5 million decrease. The next graph shows fiscal year to date versus fiscal year 23 versus 22, comparing up until now against the same period in the prior year. Comparing year to year, we're higher in revenue in 23 versus 22. However, in the next graph, you'll see our expenses are higher as well. And so actually our expenses go up at a higher rate than our revenue. The next graph talks about net income comparison. In this case, revenue minus the expense. In comparison to last year at this time, we were in a surplus at this time. We are showing a $5 million deficit this year for the same time against last year. And so we know that per BA2, we projected and we budgeted for a $8.9 million deficit. And so 6 months in, we're showing roughly a $5 million deficit at this time. These are the top 15. The next slide talks about the top 15 providers. They have remained pretty much the same by the dollar amounts that we pay to each one. And so that PowerPoint pretty much highlights all the activity within the financials, and I summarized it. And if there's any other questions, I'd be happy to answer your questions to the best of my ability.
Does anyone have any questions for Patrick? I have, go ahead, John. Go ahead.
So during this presentation, and thank you for putting it together, you mentioned that our expenses are growing, so is our revenue. Well, you said our revenue is growing, but so is our expenses. Are we at any risk with our expenses overrunning our income or inflows? So in other words, outflows overtaking our inflows?
Well, we budgeted for a deficit year, and so, yes, we are.
How badly are we going to be in trouble?
Based on BA2, we show 8.9.
8.0?
8.9 million.
Oh, 8.9 or 80?
8.9.
Okay.
8.9.
Okay, thank you.
No.
Okay, thank you.
Okay. And then, just, you might recall that at our last meeting, which was a study session, it was, I'm not going to go detail all the issues, but are any of those issues been incorporated into this plan, into these numbers at this point, or is that going to come in the future?
Well, we captured all of our financial closeout information from prior year, including our cost settlements and all. And so whatever is in these financials includes year-end cost settlements as well as information up through Budget Amendment 1. It does not include the Budget Amendment 2 changes as of yet.
All right. Okay. Thank you. Anyone else? Okay. Thank you very much. Okay, we have, I believe it's 4 contract matters, and the first one is the Landis contract overview. This is not for approval this evening, so I assume you're going to give us an explanation.
Yeah, so Dana had asked me to bring this forward just to give the board an update on a new solution that we have going in that is a contact center. Can I have the next slide, please? So from a background perspective, we have been using a solution called BroadSoft that that Access uses for the current call center. The call center software is what is used to it takes the calls, has call queues, manages them, but it also gives us the reports that we need for NCQA and any other performance outcomes that we need to track. BroadSoft was bought by Cisco, and they announced that they are ending the current product. The current product is actually one that we transitioned off a few years ago. Actually, in 2019/2020, we transitioned off of BroadSoft for the rest of the organization and moved to Microsoft Teams as our phone system. Additionally, besides the fact that knowing that BroadSoft is no longer going to be available to us after this November, it also had limited functionality as well as lack of integration with Microsoft Teams. As I just mentioned, Microsoft Teams is what is used for our phone system, and so people in the Access department actually have to use 2 phone systems. Next slide, please. So what we did was we put an RFP out, and we had representation from IT, Access, and Customer Services as part of that RFP. One of the things that we did require was that Microsoft Teams integration so that users did not have to continue to use two systems, and that it would also make it easier if they were just able to use Teams. While we received some proposals, the proposals didn't meet the Teams requirement, so the RFP was canceled. So what we did was we worked with the procurement and legal department, and we decided to invite 4 Microsoft certified vendors for demos. Ultimately, Landis was chosen as our vendor. Next slide, please. So, I already read those. Can you, yes, can you go to the next one? Thank you. So why Landis? The biggest thing is that it's easy to configure and maintain. So for example, Peter, along with one of our other colleagues in our department, they've already started building out workflows and are able to get with Access and to be able to understand like what their needs are. So it's really simple to configure, and we're going to be able to turn that around quickly. Additionally, it has enhanced reporting as well as integration with Power BI. So for example, one of the things that it has is real-time data, which we don't currently have. The data also does not easily integrate with Power BI, which we use for dashboarding. The functionality meets OCHN's needs. It was easy to learn. The folks that are currently using BroadSoft were very happy in the demos because it was very intuitive, and it is not something that is expected to be a large learning curve. We are also going to be able to choose, if we so choose to, ability to use the system for text as well as a website chatbot. So what that means is someone calls into Access, or we're going to also expand the system to customer service. OCHN has the choice down the road to decide to use text to be able to communicate with people. They also have the ability to have a chatbot on the website that people can use to communicate with OCHN. And instead of these being in separate systems, it will all be run through Landis. As we talked about, this works with Teams. It was cost-effective and easy for us to use, and the data resides in our Microsoft environment instead of being located elsewhere. Next slide, please. So for the next steps, I already mentioned this, that Peter and his team have already started configuring the system. Then the next step will be to meet with Access and have them actually start what we always call in IT kicking the tires, right? Actually getting in, using the system, and seeing does it do what they need it to do. And then we will begin to work on the transition plan. We also are expecting them to go live by August 15th. And then the next step after that is to expand to customer service. We've talked about the utilization management team using this. So it has the ability to be able to expand as needed, and we can evaluate the other functionality that I mentioned that's available. So to answer Mr. Cowan's question, why did we bring this as well? So this amount is under $100,000, and so this actually just really brought us a lot of, I think, value into this. And this is for 20 users, and so if we do need to expand this, we will have that ability to do so and still remain a cost-effective solution. I am happy to answer any questions.
I have one. If I'm reading this right from our form, so the prior contract with the current vendor was $62,000, and this one will be $62,640. Is that accurate?
I think you are looking at the wrong contract.
Oh,
I
you know
think
what? You're right. You're right.
Yeah.
I'm sorry.
Yeah.
I'm sorry. You're correct.
Yes.
So it says $57,800 for the total over 3 years. So
correct.
How does that compare to what we're paying now?
You know what? I'd have to go back and look, but I think it $2,400 a month?
Yeah, it would be $2,400 a month. And we're up in this new solution will include customer services, so we're adding more agents.
That's a good
And then
point,
an
Peter.
agent from customer service could help out Access if needed in an emergency, because they could service both numbers.
Okay. All right. Thanks.
We will confirm that number, but I believe that's accurate.
Yeah. Okay.
Question.
Sorry, John.
I know when you guys put the RFP out and the committee made the decision, But you've gotten references from other organizations that have used it before?
A reference check is always something that procurement always does.
And it was a public entity reference type, it was a similar organization?
Usually, but you know what, John Paul, I would actually have to go back and confirm that.
Okay, yeah, I was just interested in knowing that.
I will, write that one down as well.
And it would just be one one reference, or is it several? Three, okay, three. So then
Yep.
one of the three
Yep.
that would be similar, comparable to us, similar organization.
Yes, and I'll confirm with this being a little bit different process than usual. I don't know if there was any other anomalies, but once again, I'll take this back and unless there's someone from contracts who wants to jump on and answer that question, but we can bring that back for you.
And you said there would be how many users for it?
20.
20, okay. And so if we ended up having more users, would the price go up, or would it be like contract amendment? Okay.
Yes.
All right.
Yep.
Yeah, if I could just give me the names or information on
The names of who the references were?
Yeah, the previous users, organizations that have used it before. Thank you.
And are you just looking for in general companies that have used the system, John?
Yeah, just
Okay.
In general companies and
You got it.
the most comparable one to us.
Okay.
Yvette?
Do you know what the addition would be if you chose to go with the text line?
There is no additional cost
Okay, so,
was there additional cost?
okay, thank you.
Yep.
Can I ask you a question? Is that the max number, or do we have a number of how many you can add to this list?
So we can expand it to as many people as we need to. Which was one of the things that we appreciated, is that this was a flexible system, and it's also, you know, Peter can speak to this, it's been easy for him to get what he's needed from the vendor.
Thank you.
We've already met with the vendor and did the first configuration. We were able to do it with like in an hour and a half, be able to set up the test queue to start kicking the tires, as Dinah said, so very easy to put together, just integrates seamlessly.
Jonathan?
Thank you, Chairman. So I have a couple questions regarding this. We've got Teams already, we're adding the call center functions to this. Does it collect stats like time to answer, call drops, call routing, and things like that?
Yeah, that's the primary reason for purchasing this product, to do those call center kinds of metrics. We needed the NCQA, the 30-second to human answer call statistic, and it'll show that, you know, visually on the dashboard in real time.
That was where I was going, will it meet both MDHHS's requirements, but as well operationally keep our certification? NCQA, CAQH, along with the HEDIS measures. Okay. You said it's on a per user per month, and we're expecting to have 20 users in our customer service?
12 for access right now, because access is growing, and then 6 for customer service. And then the other ones are like the managers that oversee the dashboard and can activate call queues and look at metrics.
Okay.
So one of the things, sorry, I just want to add on to what Peter was saying. One of the things that we had the vision to do when we went out was it became very clear when we started talking about needing to do an RFP, because we knew for quite some time we were going to do an RFP. But we wanted to make sure, especially once we started talking to customer service and understanding what their needs were, it didn't make sense for them to not be using the contact center. So that was one of the things, is that we always knew when we went out, that it needed to not just be for access, but making sure that we got something that would really fit the rest of our organization, including customer service.
Okay. So 2 questions and I'm done. How's that? Okay, so one of them is, does it allow us to record all calls so we can go back through and listen in or review or see what we can do to improve our serviceability? I know I'll drop where I'm at Blue Cross and at Senior Health for MA. All of our call centers do that stuff, so we have continuous learning and huddles and other ways to improve what the quality of the service calls.
The feature exists. It's an optional feature within the software to do that. We chose not, as an organization, not to implement the call recording.
But but it's there should we decide to step up later on and see, is there a better?
Yes, that can be added in the storage for it, and again, it would be stored in our tenant.
Yeah, because I know that's coming with NCQA, just maybe not this year. And the other question I had was, do we have anything that allows us to maintain scripts for call center in case we do any outbound calling?
Are you talking like a IVR?
Yes.
So we did not go out for an IVR. IVR is, I'm going to mess this up, I believe it's interactive voice.
Voice recognition.
Thank you. And what IVR is that is what, when you get, like, if you were to get a phone call that says, Diana, you have a doctor's appointment, and then you hear it say Monday, you know, May 8th or whatever the date is, that is called IVR. And you can put a script in there, and then you can have it give information. That's often what they use for payments and so on and so forth. That hasn't been a need that we have or have needed, but, you know, we'd have to go back and check to see if it has IVR built into it. I think it does,
Right.
but I'd have to clarify.
So I'm thinking a valid use of it for us, because we don't have member payments and things like that, would be for like the upcoming recertification process. Just as a reminder to people calling in, if they're on Medicaid, that they need to consider those kinds of stuff. So it's outbound messaging
And
while
we,
they're waiting on hold for you.
yeah, and we do have outbound messaging that's tied to something else, but just not tied to that. But that's a good question.
Okay, and then, so I really had three, sorry. So the other was, does this system tie into stats on Odin so we can track how many times a person who we serve is actually calling in?
So the data, we've talked a little bit about this, and that is something, and, you know, Nassar can most certainly address that, but that is one of the opportunities that we would do, is that we would have the ability to be able to bring that data in, but you have to track. You know, we've had some conversations about that, and it starts to get really, could be tricky to track, because you have to have the ID of the person in the phone system as well as in Odin. So we've definitely talked about it.
But it's yet another way to know
Absolutely.
who's a high, if you will.
Yeah,
You know,
yeah,
high needs or
absolutely.
high maintenance.
The beautiful thing is, you know, we're going to be able to get data in a way that we haven't been able to, and so we're going to have things that will be, we're going to have much more ability and functionality to do things like that now than what we had.
And we can tailor those wait messages, so if you're in queue, you can have different messages come up and say things while the person's waiting in queue. You have the welcome, then you can, every X number of seconds, insert something in there.
Well, hopefully it's only within that 30 seconds till they get to a person. So, all right, thank you for your time.
All right. Anyone else? No, he's exceeded his limit for questions tonight, so you're sick. Yeah.
All right.
Okay, well, thank you. Then, there's no action required by us. This was
Nope.
merely informational. Thank you very much. And so we'll move on to an action item, which is the Crown Castle extension. And Diana, just by happen chance, you're up again.
You're getting a twofer for me this evening. So this is a request to extend the Crown Castle contract, which we had for 3 years. They are our internet provider. Since we had 2 years left on the contract, we've been happy with their, we were able to extend for 2 years, and we've been happy with them as a provider as well as their costs. We have asked to extend it. So we have a previous contract amount of $62,000. The extension is $62,640, and then we did a contingency of $6,264 for a total of $130,904.
Okay.
I want to ask a question, but you
I'm-
put on me.
No, go right ahead. Go right ahead. You can cut into your next month's questions.
Thank you.
No,
I'll
limit.
pull ahead on it.
All right.
All right, so I have just one question on this. I know that we're making a multi-year contract commitment, but do we have any bailout clauses?
That would be
SLAs or even non-SLAs, service level
So
agreements?
typically, we have an SLA, we can ask, contracts for that. Do you remember this one they almost all have an SLA.
Well, the SLA, as far as that there's a guarantee of the uptime in the service, and that if
Yes.
they were offline for any period of time, there would be money owed back to the agency.
Well, just that they have to maintain uptime,
Mm-hmm.
Yes.
yeah, or we can, yes.
I mean, that's the difference why these contracts are much higher dollars, because it's a fiber optic service provider who, unlike Comcast, say, for example, actually has to perform to the SLA as far as not just uptime, but if they sell you a gig, you gotta be able to get a gig up and down all the time, every time.
I'll follow up on the out cost.
Okay, just a clarification. So we've got a 2-year extension at 62,000, but then you mentioned 130,000. Is that the 4-year cost?
So the 130,000 is the previous contract amount of 62,000.
Right.
The extension amount of 62,000 and
Right.
some change, and then the contingency equals that total is the 130.
I get it, okay. I just wanted to make sure I was reading this correct in light
Yep.
of the presentation, okay.
So that way you have a full contract
So
amount.
it's a 62,000 2-year extension
Mhm.
with the contingency included, okay.
You got it.
Okay. Any other questions? Okay, there being none, we'll vote on this with the roll call of the Finance Committee members. Once I have a motion
Yes.
and a support.
Move to recommend to the full board.
Support?
All right? So we'll have a roll call vote.
Mr. Furman,
Yes.
Mr. Torres,
Yes.
sorry, Mr. Young,
Yes.
and Mr. Cowan.
Yes.
Yeah, quorum, all right.
All right, the motion passes. Thank you very much.
Thank you.
The next item is our MEI contract. Adam, I think you're going to take care of that.
Good afternoon. So, as you've probably noticed, our middle elevator has been down for quite a while, and the repair cost for that is $33,668.10. We've worked with MEI, Michigan Elevator Incorporated previously, and we would like them to complete the repair on this as well. MEI will install a complete upgrade of the current submersible hydraulic power unit. They will complete the required full capacity safety test on the hydraulic system as per the requirement of the state of Michigan. Once completed, MEI will turn the elevator back over to normal working operation. So this should get us back up to 3 elevators here. And just kind of a heads up for the future, we, in the future budget year, we'll be bringing some more elevator upgrades to you for approval, as the system is old and is going to need some upgrading. But for now, this will get us up to operational capacity.
Okay. Any questions? And when will they be able to move on this?
As soon as it's approved at the full board, they'll be able to move forward with it. And don't quote me on this, more if Mark's on here, but it doesn't sound like it'll take long, so.
Okay, well, that's good to hear, because I just happen to know from professional experience and working on projects that one of the biggest issues right now is elevator systems being installed are causing delays. And obviously, if you got anything above 1 story, you need to have the elevators working. So that's why I asked the question. I'm encouraged, hopefully, it sounds like they have the parts in inventory and they can move forward. Good. Yes, John Paul.
Just a question about, so many of our staff still work from home or remote, is that correct?
So we are hybrid. We are, all of our staff are 2 days a week in the office.
Okay, so I'm just seeing how that relates to the elevator situation, so.
And we have other companies in the building, obviously, that we are landlords for. So for those business operations, we want this fully functional.
Coming up and down. Okay, yeah, and as an obligation as a landlord, obviously, we want to provide, okay.
Correct.
I was just wondering, thinking of how much use it gets, the elevators in today's day and age with everything. So we have 2 other elevators that are working right now.
I have 3, if you count the freight elevator.
Okay. All right, thank you.
You're welcome.
Anyone else? I'll entertain a motion for to recommend approval to the board.
Move to recommend approval to the board.
Motion and a support. Well,
Support,
okay,
support, how's that?
that's okay. Well, I don't think he's been appointed to the finance
I don't
committee
know, I'm
yet.
looking at Sheila.
Are we okay? Yes.
Okay, all right. So you had it.
Yeah, sorry, yeah, only the committee votes. That's okay, but we appreciate your enthusiasm to moving this forward.
But there's an opening on the
That's
committee,
right.
so we gotta,
I'll save that
Yeah.
for the next meeting.
yeah.
That's right, yeah, well, there's an opening on the finance committee, so we're gonna put you on it, I hope, maybe. Do we have a support? Yes. Okay, supported, roll call vote?
Mr. Torres?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Okay. All right. Last but not least, we have the Center for Study of Services contracts.
Good afternoon. My name is Wendy Schiller. I'm the manager of quality improvement. And today I want to make a request for a new contract with a new vendor, Center for the Study of Services. So they are an NCQA certified survey vendor. We've been talking about this, I think, in a couple other board meetings, looking into this, and we're happy that we have identified an organization to work with. This is a 3-year contract in the amount of $118,645. And they would be administering the Experience of Care and Health Outcomes Survey on our behalf, and they have a lot of experience with this. They actually have been administering this survey since it was developed back in 2003. So they work with over 65 health plans across the nation, and they survey hundreds of thousands of people a year. So we're very excited to work with them. So does anyone have any questions about this organization?
How does this fit in? I'm sorry, Jonathan, you go first.
Well, you were asking one of my 2 questions tonight.
You can read my mind, eh?
So I want to know how it fits, and I know they do ECHO. Are there other surveys they do that we currently do not do, but have the opportunity or perhaps may have to under NCQA?
I know they do a number of surveys. They have mentioned for health plans, different CAHPS measure surveys that are more geared towards health plans. So they really do focus on healthcare beneficiaries. So that is their primary concern and focus. So they do offer that, and they also offer an opportunity for us to identify additional surveys we may identify for them to do. So they're open to any of that, expanding in the future, and so that's something that's very exciting.
So that was the other, they will administer other surveys for us.
Yes.
As we grow. Okay.
Yes, correct.
Thank you.
So where does this item fit in a budget category?
I believe currently it's in the quality management budget line,
Okay.
so I don't know exactly.
Well, because it didn't identify it on the form that we got,
Okay.
is this being a budgeted item? So we're gonna need to know that.
Okay.
Make sure, you're within budget, or if
Yeah.
not, where the rest of the money's coming from. So
Yeah,
if you could do that by the board meeting,
Okay.
I'm assuming it's budgeted.
Yeah,
So-
this was something that was currently budgeted, and we took it out of our other contract. We had been working with MSET.
Okay,
We adjusted their budget because they had been doing ECHO, so we just removed it from that contract
okay,
and
I
moved
get
it
it,
over.
okay, all right. Well, if you can just follow up with a communication on that, so we know that it is budgeted, and you moved it from, yeah, I don't see it, but it wasn't down here. Yeah, it wasn't, yeah, for budgeting, yeah. There's-
Okay.
Yeah, it is referenced, but it wasn't on the, we're just following the form. No,
Okay.
I'm only kidding, no,
Okay.
okay. Anyone else? Yes.
Will we continue to use, INSET for surveys?
Yes, we do. They're doing 3 of our other surveys, and we will continue that relationship. We do appreciate them and the work that they do, so we want to ensure that we keep using them.
Thank you.
Any other discussion? Okay, I'll entertain a motion.
Move to recommend to the full board.
A motion,
Support?
a support. Roll call vote, please.
Mr. Young?
Yes.
Mr. Torres? Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Motion
And-
carries.
Thank you. And the motion, is approved. And Wendy, thank you for pinch hitting. And then we'll move on now to the other side of the ledger and policy management. I'm gonna hand it over to Melchiah Newman for those items. Thank you.
Thank you, Dennis. First up on our agenda is the needs assessment outcomes report with Francis Carley.
Good evening, everyone. I'm joining Francis as well. I think our slides might have got moved around a little bit. Suzanne Weiner, Director of Communications. Just wanted to give you an update. We've been talking about the needs assessment for the past few months now, and we are pleased to say that the assessment process is complete, and we're here to provide you with some survey results. But I wanted to talk a little bit, reiterate some of the details in terms of our community outreach, in terms of getting the needs assessment out into the community and getting the results that we did receive. As mentioned before, a number of different opportunities for us to do some outreach with the needs assessment was launched in March. We provided the needs assessment up until the end of April, and pleased with the number of results that we did receive. As part of our outreach, we did a variety of different efforts, which would be electronic distribution. We did actual hard copy snail mailing, in-person conversations and work groups, as well as at many community events, and trying to have conversations with people and get the survey out. And then, working with our community partners like our faith-based leaders, as well as some of our county officials, our Oakland County Health Division, schools, so a number of different efforts. And I apologize, I did not bring my... Sorry, I'm the jack of all trades today. Just to make mention of the different presentations, as you can see, we attended 9 different work groups. Some of those work groups, you are part of those with the Citizens Advisory Council, the Recipient Rights Advisory Board, as well as our BEST work group, our strategic planning work group, some of our peer work groups, as well as our empowerment group and our peer mentor group. We also tag teamed and went out to a number of different clubhouses and drop-in centers throughout Oakland County. We were at 7 different clubhouses and drop-in centers, and were able to talk to over 130 people at those drop-in centers. Additionally, just to kind of highlight some of our distribution efforts, both electronic, hard copy, and the community engagement, just to reiterate that. Obviously, we've talked about this quite a bit. We use Constant Contact as a way for us to do a mass communication with all of our over 15,000 contacts that we have in Constant Contact to put that message out. We developed a QR code. Again, this year, this is our second year using the QR code so that individuals can use their mobile device to just scan the QR code and fill out the survey as however they see fit. Additionally, we did hard copy mailing over 300 of our service sites that reached over 1,000 individuals. And as well as, having them in our lobbies, some of our providers' lobbies. And in addition to that, we were out at community events and trainings, trying to share the information at those locations in terms of meetings and things that we attended. And we had a lot of our community partners who actually had the flyer with the QR code and encouraged individuals to fill out the survey. We did it at some of our own community events, such as the Disability Awareness event. So just tried to tap into some of those resources to ensure that we got it out into the community and were able to reach as many people as possible. Now I'm going to turn it over to Frances. She's going to talk a little bit more about some of our survey results.
Thank you. So last year, OCHN had a record response rate to the annual survey. This was the 2022 survey, and this year we exceeded that response rate by 11%. So we're pretty pleased with those results. As Suzanne described, OCHN staff were conducting outreach in the community to gather feedback from as many people receiving services as possible. By April 28th, when the survey closed, 994 people had responded to the 2023 assessment. And this included 248 responses from people receiving services. This represents the largest group of respondents, so we're also pleased with those results, and we exceeded last year's record response rate from people receiving services as well. So OCHN made a concerted effort to reach people receiving services, their allies, and other members of the community, as Suzanne described. And I just want to note that the numbers that we're showing in the slides include a batch of surveys that we received late last week. So the numbers in the slides are slightly higher than what we were able to include in the report, which went out early to midweek. In order to keep expanding on the success that we had last year, we made a few updates to the 2023 assessment. The first change was to emphasize a more equitable design. OCHN took the approach of offering both a shorter and longer version of the survey to people who were receiving services, and so that they could make the choice on which of the surveys they preferred to answer. We also removed some of the questions that seemed redundant and added some questions to assess some other factors impacting their lives around the social determinants of health. Next, we included some additional questions about crisis services and people's experiences when requesting care, whether that was from the perspective of people receiving the services and seeking those services, or whether it was from their advocates, families, friends, other service providers, school staff, hospital, or law enforcement requesting that care. And then finally, we added some questions for direct support professionals in addition to the questions that we had last year to better understand their experiences and to also help continue addressing the workforce issues and some of the issues that they're facing around the state. So given the higher response rate this year, we believe that we are on the right track. In terms of the population distribution and who actually responded to the survey, out of the 994 individuals who responded, as I mentioned, people receiving services were the largest group. This was followed by the largest group of respondents was direct support professionals, and then followed by family members of people served and staff from the provider network. They were also very well represented in this group. I also wanted to note that the people receiving services primarily receive either IDD or mental health services or both. Just wanted to point that one out. And then this is a highlight of the top most important priorities that were identified by respondents, and this is all of the respondents total, and also the services that had the highest satisfaction rates. So on the left, this is the percentage of respondents who considered the service to be a high priority. People could also select medium priority or a lower priority. And so the top 5 priorities in this survey were mental health treatment, number 1, then crisis intervention, followed by support for caregivers. Substance use treatment was next, tied with healthcare integration services. In terms of satisfaction with services, the number 1 item in the list. It was transportation, whether that was for transportation to medical appointments or for social activities. That was the first item on the list. Then followed by case management and community and living supports, which were tied. Rights and advocacy were next, and then the clubhouse was also in the top 5. So I wanted to point out that the detailed report was included in the board packet, and it also provides a lot more information and more detail about the different rankings, the different services, whether it's direct behavioral health services or some of the other support and community services. So then finally, the timeline presented shows the major milestones for completing both the needs assessment and then the annual plan over the next few months. The results of the needs assessment will form the building blocks for the new annual plan for fiscal year 24, and the chief officers are set to launch the annual planning process this month. And then following that, for next steps, we are scheduled to present the final plan or the draft proposed plan and budget to the board in the early fall. So if there are any questions?
I'm chairing this part of the meeting. Go ahead.
Thank you. Okay. As you guys know, I do love surveys. So the question I have is, based on this year's survey, which is great that it was an increase over last year, which is always awesome. We're getting more people coming out of their respective caves then. Were there any responses or surprises in terms of the results that you guys didn't expect to see? Like where something was higher than you thought it would be, or higher than it was last year, or lower for that matter?
Well, one thing that comes to mind immediately, the transportation satisfaction rates were higher than last year, and so that is something that certainly jumps out as a positive with the network. And additionally, we've also noted that the direct support professionals, they seem to be more focused on, in terms of retention and their priorities, salary benefits are more important to those respondents than necessarily tuition repayments. And so that's something I think to consider with the workforce strategies going forward.
John Paul.
Thank you. Thanks for the information in this report, too. It's very detailed. The question I have is, if you look down at the justice services and then the veteran services, so those were lower than, the others. Is there any elaboration on that?
Well, I can say that some of the veteran services, I think the participation, the actual number of people who participated who were identified as veterans, that is a lower, a smaller population group. So you'll see in the column to the far right, the percent of people who actually receive those services out of the total 994. So 9% of people. So I think it's that's a pretty small sample, and I would want to look into that more to understand, to better understand.
Yeah, I'm kind of
what the
surprised
concerns
because
were.
I mean I wouldn't think that those would be the lowest too. So I was kind of surprised to see that when I saw it, because I generally when I hear things, I hear good things about our justice services and the veteran services. So I was just surprised by that, but I know they're a smaller representation of the group, so maybe the numbers might be skewed a little easier depending upon, because it's a smaller group. But I was just kind of surprised by the lower, I guess, success number in those two categories.
If I may, I'll just say that, you know, we did reach out to those populations, veterans and justice, but we can work with those teams, with our Veterans Navigator, as well as our peer and our justice team in the future to ensure that they're equipped with hard copy surveys so that they can get hard copies right on the spot when they're meeting with people or they're talking with people or out at events. And ensure that they have the flyer with them at all times so that they can reach out to those populations a little further.
Right, and I think my next, I guess thought would be then too, then if they're not happy, then, okay, then what can we do? What more? You know, if those are areas that are struggling, but, I was just very surprised by those two to be at the bottom there.
And overall, so the Veteran Services satisfaction rate was 71%, and Justice Services, just for context, was 78%. So it's the overwhelming, I would say, group is satisfied. The majority is satisfied with the services. So there might be opportunities also to see what it is that the people having the positive experiences, what they're experiencing, and what services they're receiving, or what is working with the services, and to better understand maybe how to expand or
and the next one
take
would be
another direction.
And then the substance use prevention and treatment. So I mean, it still is. I mean, we're in the 80s in the substance, 83%, 78 in justice, and 71 in veterans, but you know, just noting that they're on the lower end for you know, in the survey. So, but the two on the bottom just surprised me. But thank you.
Bujaya.
Yeah, thank you. This is very encouraging to see that the response rate has increased by 11%. But I wanted to know what is the actual response rate of the overall survey? And then I have a couple of follow-up questions.
I don't have that data or that calculation to provide right now, but we can provide a response to the board and follow up.
Yeah, even if it is a rough number of total surveys that were sent out, because we have the actual number, the response number. I just wanted to figure out how effective or how much capturing we are doing of the total population that we approached. My second question is the highest response rate is from the mental health, IDD, and direct care providers, professionals. What can be done to improve input from other categories? For example, what John Paul mentioned. That is something we have to brainstorm about. Thank you.
Yeah, I agree. Thank you.
Any other questions? I just had one with the 96% for transportation. Was that teased out to find out where they were going, or was it all for office visits, or do you know?
The rate was captured separately for medical and then also other social activities. And interestingly enough, both of those categories had a 96% satisfaction rate. And I believe most of the people who responded were part of the group receiving clubhouse services or the vocational services, and so that's also part of the background.
And our providers would be providing the transportation service, or is it other means?
Yes, with the vocational, the day program services that the vocational providers do contract with OCHN to provide those services, and similarly with the clubhouse.
Okay, thank you. Any, Yvette?
I don't really have a question, I just had a comment. I want to say that I know personally I received follow-ups every 2 to 3 days about completing the survey, and even after I had completed it, I still got reminders. So the follow-up this time around was intensive. So some people just chose not to respond.
Can I ask a question? Okay, since I'm not on the committee yet. But I'd just like to ask a question in relation to the transportation, because I hear it in so many different groups that that's a big issue. And I look at this number and it says 96% of the people receiving that service are happy. And so I'm wondering what the disparity is in relation to what we hear in other groups and organizations that say transportation is a big issue. And yet we're saying here, guess what? We're pretty happy. So I don't know if, was it the question that we asked? Was it the level or the type of service? And I think it was open to different services that you were getting this, but I'm just wondering about the validity of the number in relation to what's in the air. And I don't know if there's an answer here today, but it just seems that if you talk to different groups and organizations, they're going to say transportation is an issue. The idea of M1 mobility was put in place because lack of transportation. And so I don't know if it's the group that we're trying to serve, okay, if that's it, or did our number get skewed?
Yes, thanks, Pastor Jones. So part of the difference, I think, is what we're seeing from people who responded who are receiving services through the clubhouses and the vocational centers. So some people in the community who do have more challenges with transportation, it's very possible that they do not take part in those activities or that they are not necessarily connected to those services. And that's one thing that comes immediately to mind in terms of the population differences and the different experiences. But that is something that we are taking into consideration and looking for ways to address the different range, I guess, of experiences in the community to help as many people as we can.
And it may be that looking at some of the other groups and say, can we compare the data that you're getting in relation to what we received on that? Because I believe that we talk a lot about transportation being an issue, but we also see people get to where they want to go, okay? And so I don't know if that's just something we think is an issue and it's not really an issue, or if it is really an issue and we're not getting the right feedback. Thank you.
Right here.
Oh, Sarah?
My question was in the similar vein with line items like community living supports. That's like a direct care worker implemented support system, and we all know that there's a very large shortage of direct care workers. And saying that 93% are happy, so was the question worded like only if you're receiving these services, are you happy with them? Or like, okay, so like I know personally we're approved, my daughter's approved for CLS. She doesn't receive them because we can't find a direct care worker. And so I can't even remember how I answered that one. But what I'm wondering is that if it was one that, like, if you weren't currently receiving that support, even if you were approved for it, that you just didn't answer it. And I took it a while ago, so I don't remember.
There were a couple of options, so happy, not happy, or does not apply to me. And so in displaying the information, I showed in the columns it was the happy, not happy percentage, that was based on people actually receiving the services who took the survey. And in the far right column, I showed the overall percentage, just for context, of people who actually do receive the service out of the entire group. So I tried to provide that context for awareness.
Are there any other questions for Francis and Suzanne? Thank you, ladies. Next, we have a transportation update with Adam.
Speaking of transportation,
Mm-hmm.
so just to give you an update on the work that we've been doing so far. So to start out, we have an internal work group of Francis Carley and Jillian Trumbull and myself meeting on a weekly basis to discuss the issue and work on the plan moving forward. The plan has kind of broken down into three areas. One area is looking at and monitoring the transportation millage that has come out. And in this area, not a lot of update at this point. We've continued through the leadership team to make contact with Oakland County to assure that we're sitting on any early work groups or making sure that we're part of that discussion. And at this point, there have been none. So we're continuing to make those contacts to make sure that when that starts up, we're right there at the table and advocating for the people that we serve. We are also approaching this from an internal and an external standpoint. On the external standpoint avenue, we want to make sure that we are aware of the community resources that are out there and that we are providing those to our core provider agencies so they can then pass those along to the people that we serve. A couple examples of this is we have recently had meetings with both SMART and an organization called My Ride 2 that can help with the transportation within the community. So we've had those initial conversations and we're looking at some more partnership with them to assure that we can pass down those resources. We want to make sure that we have real good partners there. We're also going to start working with our communications department on a message about transportation, really just making sure that we have a unified message and that we're passing it along to the people that we serve and our contracted providers. Also, kind of on the external work group stance, we have the transportation code that we're looking at. We are reviewing that, making sure that we're able to get that into our providers' contracts and working on the rate. That is something that we're working with finance on right now. So the work in that area continues. We're also going to look at the transportation utilization. So once we get that code in place, it's going to be easier to look at how it's being utilized and then see what we have to do to provide more resources for the individuals that we serve on that. Some of our internal work then that continues is, I think I've mentioned before, we've moved transportation under our provider network team. That's why Jillian's on that group right now. We have recently applied for the RTA grant. We've had this grant previously, so we've applied for it again. And we're looking, we should have word back on the grant status early summer. We would be looking for this grant to cover a PNT staff that fully covers transportation. So that would be the one point person that we have within the organization. I mentioned the transportation codes and the work group. And then lastly, we're going to start doing some work with our utilization management team about the process for authorizing transportation, as well as doing some of that tracking that I was discussing. So a lot of things being worked on, and we've got a really good team working on it moving forward. So I'd be happy to answer any questions you have.
Are there any questions for Adam?
Just a question. What were you were saying that there wasn't much organization at the front right now. Is that what it was with the millage?
So we're just hearing now that they don't have any work groups that we'd be able to join, that they're still looking at it internally. So we're continuing to ask the questions and just make sure that they have us on speed dial when they get that moving forward.
Okay, because they have the what is it? It's the smart board meetings. I always get emails about them.
Yeah,
so.
And we do have a staff that attends those and brings back notes to us.
Yeah, I always get the emails about them, and I can never go. But okay, so we're attending those.
Yes.
Okay, that's great. Thank you.
Mm-hmm.
Yeah.
Are there any other questions for
Well,
Adam?
I would just suggest, and I'm not sure who we have as a liaison to the county commission, but check out their meeting agendas, and their subcommittees. They have groups that are specifically dealing with this transportation issue, because I'll tell you offline, I was at the county economic development, the county economic forecast today at Oakland University, which Oakland did a great job. You know, of course, Mr. Young
Not
stepped
that.
out, he couldn't hear my compliment, but I'll tell you some of the discussion on that issue.
Perfect, thank you.
Thanks.
Any other questions for Adam? Thank you, Adam, for your report. This concludes my portion of the meeting.
Thank you very much, Melchiah, and our Policy Management Committee. We have a couple items, events. Suzanne?
Hello again. So, passed out the little green ribbons. Please wear them with pride. May is Mental Health Month. As you know, we send out our proclamations each year for May is Mental Health Month. We've received a few of them back that they've already presented them at their board meetings or city meetings. So we will continue to reach out and see if they'd like us to come and accept any of those, but we also are continuing to receive those. So just to highlight a few other activities that we have going on, we did hold our drive-through resource event, actually at Welcome Baptist Church and 4 other locations throughout Oakland County. This last Saturday, we were blessed with a beautiful day. It was very sunny and very nice. We probably had, between all 4 locations, about 30 or so people come through. Some of them were busier than others, but it was a good opportunity to get out, have conversations with people, give them some resources, and we were able to leave some of those resources at some of the locations, and they were able to get rid of all of the materials. So a lot of people did receive that information. So it was a really great event, and it was a nice opportunity. Probably look at other locations in the future, and maybe a little later in the month. I think we got really lucky with the weather. You never know at the beginning of May what it's going to be like. Also, just wanted to mention we have our advocacy work group coming up tomorrow. It's going to be hosted here in the Michigan Room. So we hope that we have a very active agenda for that as well. National Prevention Week is coming up starting on the 14th, and we have some social media efforts and messaging efforts. You'll get some more messaging from us on Constant Contact about National Prevention Week. We're also hosting our provider breakfast on May the 16th, and it's going to be here as well in the Troy office. Some conferences coming up. We have the NAMI conference coming up, the Mackinac Policy Conference coming up, but I wanted to mention again as well that we have the Veterans event that is going to be on Armed Forces Day, which is Saturday, May the 20th. We're hosting it at the United Wholesale Mortgage location in Pontiac. We have well over 170 people registered for the event. We have over 40 vendors coming, lots of activities for kids. So we're really excited about this event coming up. And also wanted to mention our school mental health navigators are very busy out in the communities. They have, last I heard, it was 7 events scheduled for this month that they're participating in, but it increases on a daily basis. They get requests constantly. Actually, I know of 2 requests that just came in that added to that number. So they're keeping very busy with all that they do. Also wanted to mention that we are hosting the Traveling Art Show. CMHA hosts a traveling art show each year, and the art goes throughout Michigan, and it's our turn to host it. So we got about 15 pieces coming. We're going to split that up between the Troy office and the Resource and Crisis Center and have that artwork displayed. People have the opportunity to purchase that artwork if they'd like. As I mentioned, conferences coming up. We have the CMHA conference coming up as well. I wanted to also mention that, I think I mentioned this before, that we received the Bell Seal Award, and I mentioned this a couple of months ago that we put a press release out that we received that award, and just wanted to let everyone know that we should be receiving that award this month. And this is an award that it recognizes a employer for being a mentally healthy workplace. So we're very pleased and excited to be receiving that award. Wanted to mention some press releases that we have going out, but I also wanted, I don't know if anyone was able to catch Dana on Fox 2 last Friday. She did a phenomenal job talking about our YFCC Youth and Family Care Connection. It was an opportunity. She spoke with Amy Andrews. She did a great job, so we'll have that part of your press packet, so you can at least go and find that link and watch her. So it was a good opportunity to talk about that great initiative that we have. Also wanted to mention, we already put out our May is Mental Health Month press release. We did put a mental health tips press release out related to some of the anti-Semitism and hate crimes that have been happening in our communities of late. And in addition to the mental health tips that we put out for that, Dr. Posios hosted a staff conversation last Thursday. We had an opportunity we had well over 50 to 60 staff who participated, and everyone was able, he provided a presentation, everyone was able to have conversations and just talk about their feelings. So it was an anonymous, confidential forum where staff could talk about their feelings. So it was a great opportunity for us to address that. Also, we're going to be highlighting our traveling art show, and then also highlighting all of our great justice initiatives that we've been doing throughout the many years that we've been doing justice services at OCHN. One last thing I wanted to mention is also happening tonight is our co-responder, Hillary Nussbaum, is being honored at the Bloomfield Township Police, and she is being honored as the Civilian of the Year tonight. So as you can see, all of the great work and practice, and she is well deserving. She was our first co-responder, so she's well deserving of that award. And that's all I have. Do you have any questions for me?
It's a full month, so.
Is this my
Yeah,
time again?
go ahead, absolutely.
I want to thank, the group for the support of the drive-through over at the church. Thank you very much, and we on Sunday gave out an additional, 50 bags of that information, and I'm here to ask for another 100 bags because the ministerial fellowship meets on Thursday, and I'd like to make sure we give that to the 25 churches that are associated, with the fellowship, so that we can get that information out, and the additional ones, since we ran out Sunday, then I could have those there. But just excited about the outreach, that this group has done, and the extra work that they're putting in as far as getting the information out. I also learned at the drive-through about having I guess, and I will call it a personal Narcan stand that you could put inside the building, and a person can just pick those up. I was very much surprised. We had some extra bags. We just said, if you need this, people walked up and got them, and our plan is to put one of those in the church so that a person can just privately pick one up or what have you. And I'd like to share that with the ministers on Thursdays as well. But thank you for what you've done. Thank you for spending that Saturday with me, and thanks for leaving those extra bags.
Absolutely, and we'll be happy to get you more bags. You're welcome.
All right, great. All set. Thank you very much, Suzanne. All right, our next item is board survey, CEO evaluation. Edna White.
All right, good evening, everyone. I appreciate Suzanne passing out those packets, and I'll go over them with you, and we'll do an overview of the contents and kind of talk about next steps in the process for the CEO. Well, yeah. All right, so last week we completed our 360 evaluation for the CEO, and by way of reminder, this is just one tool that you can use as input as the board prepares to complete the board CEO survey. On the left side of your packet, you have the survey results, summary results that were printed out. You have a legal size packet that is the full detail results and comments for each population group. And due to the fact that the majority of our comments came from CEOs, from OCHN staff, so that you could best read it and not have to read tiny print in an Excel sheet, I got some help to put that in a separate document. So these represent the staff comments from the 360 survey. And on the right, for convenience sake, you have a PDF printout of the board survey. This will be sent to you electronically via SurveyMonkey, but I thought it'd be helpful if you had a copy of the survey itself, just so that you can have a good understanding of what content is in the...
And you said that we, the board members, are going to receive the survey through SurveyMonkey?
Yes.
Okay, what email address is it coming to, so we are on the lookout for that?
That is going to be coming to your OCHN
Okay.
email. I did make a note to mention that, please.
Okay. All right, sorry.
Oh, no problem. No, just want to make sure I'm covering everything. All right.
So you said this is preliminary information? Is this is information that we've gathered so far? Is that what it is?
On the left side is the completed 360 survey. I'll spend some time going over that today.
Okay.
And on the right is a PDF printout of the survey you'll be doing online.
Okay.
All right. So on the left, what you're looking at, the 6-page color item, that's the summary information from the 360 survey that was completed last week. And question 1, I asked us to identify which population group you most closely identify with. So in the summary report that was produced by SurveyMonkey, and I do want to say that I was supported with some technical assistance by Christine Burke and Nasser Doss, so I appreciate them helping to make sure that the collection tool was working properly. But the first question merely asked people to identify what population group they most closely identify with, and then the rest of the questions are the 5 general questions that we ask people to complete. So the first question related to promotes awareness about public behavioral health services available to the local community. The second question was works closely with community leaders in determining local health care needs by attending OCHN network and community meetings and events. The next question maintains an active advocacy role in promoting OCHN's mission to inspire hope, empower people, and strengthen communities. Question 4 was effectively communicates programs, services, and activities of the OCHN network through meetings or reports. And the final question, the degree to which the CEO values people and employees and shows genuinely concern for their well-being by implementing policies or taking actions to ensure individuals are treated with respect and dignity. So this is the summary response. The larger document that you see, I see some of you flipping through right now, it's based on the population group that responded. So as you can see, we continue to struggle with getting direct responses from individuals served. I should spend a little bit of time letting you know how the survey was delivered to individuals. We certainly had the email addresses for all the staff at OCHN, but we relied on our collaboration with the communications team to share all of the information that was available for contacts in constant contact. So altogether, over 400 people, or I should say 400 email addresses, received this survey. And we got 167 responses back. In terms of how we got the data back from SurveyMonkey, while we did upload the email addresses to the survey collector, we did not have a way of identifying who responded. So the results of the survey are anonymous to the administrators of the tool. But using this document, this larger document, you can see the respondents were just labeled 1 through 167. Again, we have no idea, who's who, identifying, their population group and their scoring response for the CEO. And there is space in each one of these population groups so that you can read the open comments that each of the respondents put in if they chose to do so. I know it's a big packet, but we got a couple of weeks. And lastly, there were quite a few comments from OCHN staff, so to make it easy to read, we just produced it on a separate document. I believe there are 9 pages of open comments from OCHN staff. So before I move on to the board survey, you can let me know if you have any questions about the 360.
Yeah, go ahead.
So you said that even though it collects the email addresses, no administrator or anyone else can see those emails, so it's anonymous, correct?
That's correct.
And is there any way for a person to take more than one survey?
So part of the setup that we did for SurveyMonkey was to disallow an individual to take the survey more than once.
So just to recap so that the public's aware, you've given us all the responses to date. I appreciate you, in essence, have given us the raw data with the actual comments of the 167 respondents, and also additional information, and which is very good. And also, those SurveyMonkey, the surveys they come back to you or to your office?
They come back in the SurveyMonkey portal.
Okay.
So I have access
But
to
you
the
have the
results.
access to it, right?
Mr. Doss and Ms. Burke.
Okay, all right. Somewhere, someone mentioned chain of custody issues, so now we know the chain of custody.
I think the chain of custody question actually referred to the public comment.
Right,
but
right.
for the sake of what you're saying,
Yes.
it comes into the SurveyMonkey tool, and each one of us with login credentials would have to log in and actually pull those results.
Okay, thank you.
Mm-hmm.
Anyone else? All right.
I have a question.
Yes.
So, a huge portion is OCHN staff. Were the numbers similar last year? Do you know?
No, last year, I believe, I want to say we had around 77 responses or something like that, and 40 were OCHN staff. So we pushed to have the survey completed, and we had a very large response from our staff. Of course, we have more staff as well.
So then we had 77 responses and 40 were staff last year?
Mm-hmm.
So about half?
Yeah.
Okay. And then this year, it's probably a lot more than that, probably closer
It's
to like
70-some percent,
Is it 70-some percent?
79.04.
So almost 80%, right?
Mhm.
So, okay, so it went up about 30% for staff, but it went down in other categories.
Yeah, I think we may have gotten more from provider staff.
Mm-hmm.
You know, that's something we're trying to resolve.
Yeah, I would like to see more diversity and, you know, in this as far as who it's coming from. But, okay, those numbers help me, thank you.
Mhm. Again, we use the constant contact data that we have, and, you know, this has been something we've been, looking to resolve for quite some time.
I also would like to add that there was some difficulty in sending out the correct survey initially.
Mm-hmm.
So it was recalled and then sent a second time.
Right.
So that may have had some impact on various other populations outside of the organization. People inside the organization understood, the
Mm-hmm.
process and were better able to respond. And also, statistically, that is a valid sample for, internally with respect to the organization and a substantial response for what one would expect, so.
Because we got 0 for family member of person served. That's, it's concerning.
Yeah. Agreed.
Thank you.
Mhm.
All right. Anyone else?
Can I ask a question? On a survey like this with other organizations, do they have opportunity to receive this survey in relation to the help or the support that the chair is giving, or the organization? As an example, and I'll just take one of the groups I'm over, like the Oakland County Ministerial Fellowship. And certainly the work that OCHN does and the fact that the chairman has met with us and talked with us about the importance of the organization, blah, 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 would they be eligible to respond to this survey?
Oh, you want to post it? So I just want to address a few things in regard to the distribution. So because of CEO 360 is very unique in terms of there aren't a lot of those going on for leaders within our community. And so that's not one that you just send out to the masses the same way we would to the needs assessment. It's really kind of geared toward those individuals who would have the most interaction. The other thing that we talked about this year in the distribution, the way the timelines were set up, the needs assessment was going on the same time the CEO 360 survey, the same time that there were surveys going on for the health division. So there is a limited amount of survey fatigue in that where we see such a large response to by families, person served to the needs assessment, and then the CEO survey came out after. And some of those questions are similar. So those are some of the things we talked to your point, John Paul, how do we improve the response in some of those categories? I think if those surveys are not running at the same time or overlap, that should change some of those outcomes.
Mm-hmm.
Is that helpful?
Yeah, it is. I remember these things coming up actually. Then we had to pull it or put it out, and then we pulled it back, and then there was the overlap. But yeah, just I would like to see more diversity and distribution of respondents in it. But
yeah, so it's about half that goes to staff when you look at the 400. The other half goes out to the community. The original survey that went out actually did not go out beyond our building.
Mm-hmm.
So that survey had only gone out to staff when it was recalled within a few minutes. We pulled it back, and then once corrected and approved by this board. But I do understand, and we have discussed that in upcoming years, that we should not be having the needs assessment at the same time as the CEO. I think it's confusing. People see our name, so they see OCHN coming in on that subject line. They may see survey coming in on the subject line, and they may decide, I've already done this survey. So there might be some confusion. So that is something we'll definitely change next year.
Right.
All right, so I'll move on to drawing your attention to the CEO survey, the board CEO survey, which will be released today. And the survey itself is unchanged from the one we used last year, so I will walk the group through it. Bernard, do you want?
It's also unchanged from the prior year, correct?
That's correct. So there are a total of 28 questions. The final question is open comments, so that the board members may choose to do so if they would like. The remaining 27 questions are divided among 10 categories. And so you'll see some of these as being multi-part. So for performance area number 1, the question is the executive director, or the category is the executive director has a clear understanding of the mission, values, and strategy of the organization and plays a key role in translating that mission into realistic action. And this is a multi-part question. It has 4 parts, so they're labeled 1A, 1B, 1C. The tool numbers each question individually, so you're going to see a total of 28 questions, but as far as the broad categories, question number 1 is broken up into 4 parts. Performance area number 2 relates to employee morale, the degree to which appropriate actions have been taken to monitor and enhance employee performance. The executive director has worked to promote positive morale among staff. This is also a multi-part question. This one has 3 parts. So you'll take your time and carefully select which option you feel is most appropriate. Performance area number 3 is provider collaboration, and it addresses the degree to which OCHN providers and direct providers have delivered services in an effective manner. That is a 2-part question for you. Area number 4, collaboration with individuals served by OCHN, the degree to which the executive director has demonstrated the ability to interact effectively with individuals served. The executive director has developed collaborative relationships among the people that we serve. That is a 3-part question. Performance area number 5 is services and supports. The executive director has appropriate knowledge of the organizational programs and services and provides suitable oversight for the provision of high-quality programs and services. That is only has 1 question. Related to financial management is performance area number 6. The degree to which the board-approved budget has been followed, and the executive director is knowledgeable regarding financial matters and has effective oversight that allows for sound financial decision-making, and that is a 3-part question that you'll see on the survey. Area number 7 is administrative operations. It addresses the degree to which appropriate management practices and processes have been developed and implemented, and the executive director has assured that the organization has suitable systems, policies, and processes that allow for effective oversight of administrative operations. That is a 2-part question. Area number 8 is board collaboration. It addresses the degree to which the board has been kept fully informed in a timely manner, and the executive director works effectively and maintains good communications with the board. That is a 3-part question. Area 9 is stakeholder collaboration. It addresses the executive director possesses an effective professional relationship with local, state, and national partners. And there you are presented with a 3-part question. Finally, number 10, crisis management. It addresses the executive director responds appropriately to unanticipated or difficult situations associated with the unique vision, mission, and values of OCHN. And that is a 3-part question. And the final question again, any overall comments regarding the CEO, executive director's performance? That's an open field for you to input, your response. This goes out today. It is due back on 5/22, so you'll be instructed to respond no later than 5 p.m. on Monday, the 22nd. And the compiled results will be distributed to the board on 5/26, according to the timeline.
All right, any other questions? So keep an eye in your mailbox for this survey, and then try to fill it out in a timely manner, so that can complete complete our end of the bargain.
Yeah, I was just going to offer an opportunity for members of the CEO Evaluation Committee to provide any comments or instruction.
We're on schedule. Go ahead.
All right, so I wanted, just for folks to recognize that we tried, this is the same survey we've used since we started, so this is the third year of 3 years. We looked last year at modifying it. It was too hard, so we are stuck with it. So even if you don't like it, you have to do it. It's required for all board members, whether you've been on the board for a day or for 3,000 days, like someone else. The other is on the first page. You'll see that we've actually defined what distinguished, which is a 5, what exceeds expectations means, what's meets expectations, what the needs improvements score of a 2, or what the area of deficiency a score of 1 is. So we tried to give you some very frank discussion so that we might not, as board members, be all over the road when they say, oh, someone is distinguished, or they need improvement. So we were trying to give you, specifically when this was done a few years ago, we tried to give you guidance as to how we felt we wanted people to score someone if you felt that they needed to be marked as distinguished, okay, or marked as meets expectations. All right, and again, all board members will have to do it. We'll have to make sure that the survey is sent out. Well, it's getting delivered electronically to all of us, correct? Okay.
Yes, it's being sent electronically.
Okay. And as Edna said earlier, yes, we do have the feedback from the surveys, but we also have all kinds of other materials from the past year of performance, and activities and materials that have gone out from our CEO and team. So if you want to go into analysis paralysis or analysis overdrive, there certainly is an opportunity for that. I think as an evaluation committee, we would welcome any comments one has at each question and at the end, because that will help us as well, so that we can assess not only the survey and your assessment of the prior survey, but as well the opportunity for us to give Dana a fair and realistic assessment, because it impacts both her base pay and her bonus, all right, for those that weren't aware. So it affects her compensation on 2 fronts. Yes, Dr.
I have a question. Does the package include self-assessment by CEO?
Do you want to speak to that, Dana?
Yes, it does. And in past years, I actually did a presentation. This year, I'm going to do the same self-eval that our staff uses. So I thought I would align it with what is already being used and practiced by our staff and fill it out. Mm-hmm.
Other executive committee comments? 'Cause I know I was speaking as the chair of that committee, but not necessarily as other members, but I hopefully am speaking with the wisdom that you guys have given me, or have allowed me to rent. Okay. I'll give you the floor back.
Thank you. All right, thank you very much, Edna, for all the work that you put into this and information that you provided us, and we look forward to completing the surveys. Okay, so.
Before Memorial Day.
Right, before Memorial Day. As was noted during the approval of the agenda, we have had a request to go into closed executive session to discuss, not discuss, but to consider a pending claim and negotiation of that claim. And so we'll need a motion, support, and then a roll call vote.
I'll make that motion to go into closed session.
Motion?
I'll second it.
Support?
Yes.
Any discussion? There being none? Oh, I'm sorry. Sure. Yeah, everybody's got to clear out anyway, so, yeah. Okay.
And that's pursuant to Section 8(1).
What Mr. Hooper
C.
is, making reference to is the statutory reference under which we're moving. So thank you very much.
I'm sorry, 8(1)D. What? Oh, E, I'm sorry, E. Now I've got it right. Yes, 8(1)E is an easy.
All right. Okay.
We haven't voted yet, but we're now asking.
Any other discussion? There being none, roll call vote, please.
Mr. Landsman?
Yes.
Mr. Young, is no longer in the meeting. Mr. Furman?
Yes.
Mr. Torres?
Yes.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. May? Yes. Ms. Woodruff?
Yes.
Pastor Jones?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Okay. All right.